Ladies and gentlemen, all protocol observed. On behalf of the government of Pakistan, I welcome you to this event. And I want to begin by paying rich tribute to Sabina and Ofi, not only for their thought leadership in introducing a new metric for measuring poverty, but also for their efforts to institutionalize its adoption. As you all know, COVID-19 is threatening to wipe out the development gains of the last century. And in doing so, it is also reversing 3 decades of gains in poverty eradication. The MTG on poverty eradication, as you all know, was achieved 5 years ahead of schedule, but now with the corresponding SDG, we are sadly moving backwards and fast. It is, in fact, the first SDG which refers to poverty alleviation, and it refers to ending poverty in all its forms and dimensions, and not just income poverty. The first SDG calls for action on all kinds of deprivations experienced by poor people in their daily lives, such as poor health, the lack of education, inadequate living standards, disempowerment, and poor quality of work. So I'm very pleased to share with you that even before the pandemic, our government had invested heavily in fighting both monetary as well as multidimensional poverty. Our government had set up the largest social protection program in the history of the country. The approach we have adopted targets different disadvantaged individuals through a coordinated set of more than 140 interventions, all of which are linked by theory of change. There are policies and programs for poor women, for non-affording students, the undernourished, for those that risk medical poverty, for others that need livelihood opportunities. There are interventions under the umbrella for daily wage earners, for our overseas laborers, for orphans and widows, for those that are disabled, for others that are homeless, and there are also labor market interventions packaged in this mix. And all these interventions are grouped under the ESAS umbrella, which is our government signature program, and which in our local language means compassion, as our Prime Minister just outlined. Our government is conscious that now, with the pandemic, it is even more important to address multidimensional poverty. So even while we were grappling with COVID, we rolled out a bold new health and nutrition conditional cash transfer program. We are also scaling up our education conditional cash transfer program nationwide because we realize that the costs of COVID are not limited to lives lost and morbidity. The costs are staggering in terms of hunger and malnutrition, and children dropping out of school and foregone healthcare. Excellencies, ladies and gentlemen, in my own country, Pakistan, within 10 days of the lockdown, our government committed over $1 billion to deliver emergency cash to over 15 million families. As our Prime Minister just mentioned, this is the largest social protection program in history, delivered end-to-end digitally in the most difficult of circumstances. Our experience with ESAS has taught us that it is possible to make quantum changes in the delivery capability of governments. But in order for that to happen, bold policy, good data, and an unwavering commitment to integrity and transparency in delivery and whole of government mobilization is a prerequisite. And that has been the cornerstone of our poverty alleviation work. I genuinely believe COVID-19 has created an inflection point. Today, we have the power to make decisions to reverse decades of neglect and sparse progress, and to provide social protection to the 4 million people globally that lack it. And it is here that the metrics, such as the MPI, will help tremendously in helping to shape public policy in the right direction. History shows us that disasters and their tragic consequences have a tendency to catalyze broad-based social change. So we now have a one-in-a-generation chance to build a fairer world that ends poverty, inequality, and the climate crisis. Let's not waste this chance. I thank you, ladies and gentlemen.
Thank you so much, Dr. Nishtar. She, like many of you, both speaking and viewing this event, was faced with a crushing challenge: how to design, develop, fund, roll out, monitor, and sustain emergency support to millions in short order. Her address outlined a strategy at once compassionate and competent, ambitious yet efficient. But what really strikes me was the attitude and the need to follow up on the impact of the policy on the ground with curiosity and honesty, to see what wasn't working, adjust and improve. And these qualities are really crucial to making this the inflection point she described.